Welcome to the Soulful Surgeon Podcast with Dr. Lisa Hunsicker, a sanctuary for healthcare workers. In this space, we honor your stories, your struggles, and your triumphs. Here, you are more than your role. You are seen, heard, and celebrated. Join me as we explore conversations that nourish the heart, elevate the mind, and remind us why we chose the path of healing. This is your time. This is your place. This is the Soulful Surgeon Podcast. Hi, everyone, and welcome to the Soulful Surgeon Podcast. I'm your host, Dr. Lisa Hunsicker. This is the place where healthcare workers come to be seen and heard. And today I'd like to talk a little bit about physician burnout. This is something that has been top of mind for many of us, and the longer that you practice medicine in whatever capacity, the more that you know and understand the feeling of burnout. And this comes from many different things. It comes from fear, dealing with all the pressure, fear of making mistakes, fear of malpractice, fear of being publicly shamed or assassinated in Google reviews that you can't really respond to from people who may or may not be crazy. And so, we're dealing with that. We're dealing with long hours. We're dealing with staffing, being short-staffed. We're dealing with excess charting and medical records. I know for myself, I do a surgery. I have to meet the patient, do all the paperwork, but then I have an appointment that I have to generate all this paperwork from a malpractice standpoint that protects me and to basically say that the patient understands what they're having done. But this takes a tremendous amount of time. And then I have to go into the OR. After I finish the pre-op, then the next visit will be doing the surgery. And then in the surgery, I have to do all of the paperwork on the computer. I have to generate an op note. So I did an operation, then I write an op note, and then I have to fill out all of my office paperwork. And then I have to dictate an op note. And then I have to get the op note. And then I've got to collate all of the billing and get that over to the biller and make sure that's done in a timely fashion. And so there's lots of redundancy. And then we're meeting people who may or may not be nice. They're rude, they're unhappy, they're dealing with tremendous stress because they have a medical illness. Sometimes it's a mental illness. And how they show up for us may or may not be pleasant. And now, with the way insurance reimbursements are so poor, you have to see more patients in order to get some revenue, in order to keep your doors open. So now the patients are angry. And so this is one thing after another, and our workspace is so complicated and so intense. And what we find is that it's getting longer and longer and longer, and our work days are the longest parts of our days, and our time with our family, our time with our friends, our time to ourselves gets squeezed and in many cases just gets negotiated away. And one of the things that happens is, you just run out of steam. And for some people, as you've heard me talk about, like we had 3 surgeons who have died by suicide in the last year or so. Now, the other thing is if there's any difficulties in a home, then that's the platform to which, it's our foundation. And so we're depending on that to be stable while all of this work life is so unstable. And when we talk about burnout, it's really where you get to the place where you just can't do it anymore. And you're despondent, you're apathetic to your patients, to your life. There's no joy. And you can even be around your family and still not have joy because you can't separate from the struggle at work. And I think in any case, whatever the burnout is from, in our scenario, it's from how we practice medicine in the state of healthcare today, but certainly is applicable in many aspects. The way that we treat any disease, the idea is ideally that you figure out what the cause is as opposed to just treating all the symptoms. Because when you treat the symptoms, you end up giving medications that have side effects. So then you need medications for the medications, and you do procedures and they have complications. And then you have to do procedures to fix the procedures. And so we have all these layers of band-aid treatment of symptoms as opposed to getting to the root cause. And I think that this is something that we have to really talk about. And it's really getting back to talking to the actual healthcare teams. And the people who are asking the questions need to open their ears and they need to open their hearts. And I would invite them to spend a day or several days with these teams. And I invite the first person that they start with is a trauma surgeon, because their days can be over the course of days without a gap. And so many times they have 24-hour call, but then they have other things that they have to do. And I invite people who have not done that to spend some time doing that and see the fatigue, see the emotional exhaustion, see the mental exhaustion, and really see how their ability to perform is impacted by these tremendous physical and mental demands. And, the thing is, then we have these things called Doctor's Day where we're going to celebrate the doctors, but like really it's not. And, literally I got for Doctor's Day, one of the hospitals gave us a pen that said, "Thank you for all you do." Like, here's something that you could do more charting and more work with. And, inevitably it's like a drinking container. And it's all, of course, marketing that has their name on it. So it really, they could have done a TV paid ad, but instead they bought some things to distribute to the staff. But really, is that what the staff needs? And is that important to them? And so when I'm thinking about Doctor's Day, one of the things is that they reached out. One of the hospital systems has reached out. And the first thing that they want to do is they want to redo the doctor's lounge. And in one of the hospitals, it was just redone just a couple of years ago and was very nice. But they spend all this money and all this time redoing and redesigning it, and then not really changing anything about our work-life balance, the things that we're struggling with. And they don't really ask us. Like, they ask us, what would you like to see in the doctor's lounge? And knowing that we're going to spend very little time in the doctor's lounge, maybe a lunch or a meal here or there. The other thing is that communication. And so I was involved in a wellness conversation at one of the hospitals, and, they said, well, we just reach out to the physicians, but nobody responds. And when I sat and I kind of dove into this a little bit with them, the interesting thing is that, there are hospital employed physicians and there are private practice physicians, and everyone who works at the hospital in either capacity has been assigned an email associated with that hospital. And what ends up happening is that they are querying and sending information and all these things to emails that have never even been opened, because many of the staff have no idea that exists. And so it's like getting back to have the conversation with the person. You can't get the conversation because no one is talking face to face. No one is checking in. How are you doing? Are you okay? Is your family okay? Is your practice okay? Is your patients okay? Are your outcomes okay? Like, no one is having these conversations and no one is checking in on each other, which is what I think we really need to be doing. And instead, the hospital systems who appear to be committed to wellness are doing these things, and they're not getting the feedback that they want, and they're not getting the participation that they want, because it's either irrelevant, it's just not possible based on the work schedule, or it's just not even being received. And one of the conversations that I had was, well, what do you think of this? And I said, I didn't even know I had this email. I've never opened it. And they said, well, can you just check it? And I said, well, I could if I knew where it was and I knew how to access it. And so literally a week ago, we had this conversation. I was connected up and said, hey, can you help this doctor find still no response at all. So a lot of this is communication to find out what it is that we need. And we as physicians in the healthcare community, we all have to be able to give more information back as well. And, one of the things I was talking with another physician, again, in the Doctor's Day celebration, one of the hospitals had a week long celebration and they set up a room with a mini golf and it was a little putt-putt thing. And it was about 2:30, 3 o'clock in the afternoon. And one of the physicians stopped by there and the whole team, the wellness team, is so excited to see them. And they're like, we don't understand. Like, we did this really great thing, but no one is here. And I have no idea. And for those of us in medicine, we're like, well, no, duh, right? Of course, no one's here because the surgeons are in the operating room and they're operating. And the hospitalists, they're on the wards, and the intensivists are up in the ICU, and the nurses are all at the bedside. So you should open this up to family and friends who are there visiting, or maybe some of the family that is waiting on their families to come out of surgery because those people have downtime, So this was the kind of thing that I think keeps happening, and we're now having these conversations. And so one thing I would just encourage to all of the hospital systems, I think we need to communicate, and I think we do very well with texting. And there certainly are group chats and WhatsApps and all these kinds of things where if you want to get information out, you need to get it to us. And I know for me, as a surgeon, I'm not on my email all day. I don't get to that sometimes until 10 or 11 o'clock at night when I'm falling into bed to see what else has happened, because this is when I've literally just stopped going. And I think we have to have a way to communicate of like, hey, surprise, we've done this great thing for you. We have this lunch for you. Come by. It's a one-liner so that you can reach out to people. But the other thing is that we have to look at the cause of burnout. And this is an issue that we're dealing with. And at this point, I feel like if you really want to cure burnout, you either die out or you ring out and you leave medicine. And that's not the way it should be. No one should be dying over this. And no one should be in the place where they have to leave in order to find some sort of sanity and some internal homeostasis and safety, and that you have to leave in order to be a human being. And we also have to change that whole format of criticizing people who, they're weak or they're just lame and, suck it up. And like, we need to have these conversations about restricting work hours, about how we go to work. I mean, if we look at pilots, they can run 8 hours and then they're out and they're flying a plane. For me and surgeons, we are inside people's bodies and there are no time restrictions for that. The nurses who are in the OR with us, the techs who are with us, there's no restrictions for that. And so there's no room for fatigue, and we just don't deal with it. And so we're just going to keep on keeping on. And that's the concept of like, well, that's the way it's always been, and that's the way it's always going to be. But we're not going to have anybody to do this when everyone just decides, this is not working anymore. And I need to leave medicine. And this is going back to the whole idea of vacation. I think we need to work in regular vacations. I think we need to do it frequently. We need to do it often. And I think we need to take away the stigma of being flashy and rich, and that there's the doctors and the healthcare teams are so rich and they're going on vacation because they make so much money. Let's turn it around. Let's call it what it is. This is the healthcare teams escaping the job that just empties their soul. And we're trying to get back to refilling our own cup. We need to be with our families. And this isn't about money and flaunting. It's about escape. And The more that we step out of that, the better we feel. The problem is, the better we feel, the more we don't want to go back. And what we need to do is we need to have a passion for our patients and our medicine that we deliver, whatever specialty it is. But we also need to be a person who can go to the doctor, who can take a sick day, who can take a rest. And when their family has a death, they can go and be with their family. You can sleep at night or during the day, depending on your shift, but you're sleeping regularly. So all these things are mattering. And, we talked about the 7 remedies. And when we look at all these beings that we need to be, when we look at burnout, if we look and assess those 7 remedies, they're compromised. Almost every one of them is compromised. And if we want to look at burnout, we've got to address each one of those and say, look, I have gone to all of my appointments. My mammogram is up to date. My GYN is up to date. I've gone, my PSA is up to date. My colonoscopies, like all the things that we know that we insist to our patients we need to do. But we also need to eat well. We need to have good nutrition. We need to exercise. And we need to get rid of all of this toxicity that we are absorbing all day. And we're not necessarily doing that. We just absorb, and then we come home and then we rush to be with our kids because we're feeling horribly guilty that we're not spending the time there. And then we just fall into bed exhausted emotionally and physically. And then we get up and we do it again over and over and over again. But we're filling everybody's cups, but we're not really filling ours. And so I really want to be mindful, and we really have to start taking burnout in a different light instead of take a bath. If I hear take a hot bath one more time, I'm just going to completely lose it because that doesn't refill my cup. It calms my nervous system down and it helps me relax to be able to get to sleep. But ultimately, when I'm not valued as a healthcare worker, when I'm not reimbursed, when I have a business I'm trying to run and I can't make ends meet and I'm trying to figure out how do I pay my staff? How do I keep a roof over the head of all my patients? How do I have time to see patients in an adequate amount? And how do I not go bankrupt? Because this is a defunct, poor system. Like all these things, we're not really fixing those. So a doctor's day with a nice meal, yeah, that's great, but that doesn't work for burnout. And I think we have to really work on doing that. If you have any suggestions of things that your system does that you find really helpful and that you feel like is very refreshing to you and really fills your cup and helps you recover from the hard dealings of being a healthcare worker, please put that in the comments. Reach out to us as well. You can reach out on soulfulsurgeon.com and reach out to me directly. And if you have any suggestions that you think are really going to be helpful to the rest of our community, I ask you, please reach out to me and also put it in the comments and let's do a podcast for this because we've got to tell other folks how to do this. If anyone is finding something that's working and working well, let's do it because the answer right now is let's go on a vacation that we don't necessarily come back to work from. And that's not going to sustain us long term. It makes us feel great, but long term, it doesn't serve our patients and it doesn't serve our communities. And so we have to find that balance. So let me know what you're doing. Thanks so much and have a great day. Thank you for joining me on the Soulful Surgeon Podcast. I hope today's conversation offered you reflection, encouragement, and a reminder that you are not alone on this journey. If this episode spoke to your heart, please share it with someone who might need it as well. And don't forget to subscribe so you never miss a moment of connecting with healthcare workers all over. You can find us on the web at soulfulsurgeon.com. You can find us on Instagram at Soulful Surgeon. And you can find us on LinkedIn at Lisa Hunsicker, MD. Until next time, take care of yourself the way you care for others. And remember, your story matters here.